Good morning and welcome to the audio lecture PowerPoint on blood pressure. Blood pressures are to help provide information about condition of the heart, arteries, arterioles, and cardiac output. Please have your book still available as our resource to book for you. Best indication, blood pressure is the best indication of a patient's cardiovascular status. And look at the third one. It may increase with age. Now, I pulled this from your book. Look on page around 500 for the chapter for blood pressure. I want to make sure that you understand arterial blood pressure is a measure of the pressure exerted by the blood as it flows through the arteries. Also, look here for systolic blood pressure. I want you to read that. And I also want you to read diastolic. And while you're reading that, I highlighted that we all should know our pulse pressure. Our pulse pressure is the difference between diastolic and systolic. You will write your pulse pressure every time that you do your vital signs. Thank you. Please look at this slide as I am pointing out your normal for the blood pressure, systolic, your diastolic, and your pulse pressure. As you can see in the book, this is how we will relate hypertension, over 140 systolic and over 90 diastolic. And look how we're looking at hypotension. Now, as we say here with the American Heart Association, I am going to pull a graph from the American Heart so you can see the most updated guidelines. And here you go. This is from the American Heart Association and American Stroke. So look at these guidelines and understand how we go through stage 1, stage 2, and hypertensive crisis. I want to make sure I refer you back to your ATI module for taking blood pressure. Please read the information and also look at the videos. Remember, you're going to deflate that cuff 2 to 3 millimeters of mercury per second. Have the patient not talk. Remember I spoke to everyone about quarter cuff sign, which I will point out in the book. I wanted to point out blood pressure is measured in millimeters of mercury, and this is how you write it, millimeters of mercury. This is how you write your blood pressure, and I also want you to include your pulse pressure. Please read this example. There are always different things that can interfere with taking a blood pressure or interfere with taking blood pressure readings. So look at this PowerPoint. Look, if the cuff is too small, look what happens. If the cuff is too big, look what happens. And then also, we can cause the patient pain. If we're pumping it too high, they get anxious, discomfort, and then we have a high reading. So we have to make sure that when we're taking a blood pressure, we've had this before in the past where a student took a blood pressure on the wrong arm. Any patient, I'm going to reiterate, any patient that have a mastectomy, if it's on the right side, the right mastectomy, you don't touch that right arm. You do not take blood pressures in the right arm. If they have a PICC line, you don't take it in that arm. Okay, if they had a stroke, take it in the unaffected arm. So I hope I beat that drum. Mastectomy, if they had a left mastectomy, you're going to take the blood pressure in the right arm. If they had a right mastectomy, they're going to take the blood pressure in the left arm.
The blood pressure. One, you should be seated and relaxed for about 15 minutes before you actually take it.
For about 15 minutes before you actually take it. You should not have consumed alcohol or coffee for 2 hours before taking your blood pressure. You shouldn't have smoked 15 minutes before taking your blood pressure. All those things affect the arterial resistance and therefore will have an artificial elevation, or for most part will be elevated beyond what it should be. The other thing is cuff size. We showed the cuff before as fitting for a normal person. If you have small arms or large arms, you'll have a falsely elevated or reduced blood pressure. So if the cuff is too large for your arm, you'll have a lower blood pressure than you should.
blood pressure than you should.
And if it's too small, he'll have a higher blood pressure than you should.
So the cuff should be about 80% of the circumference
the cuff should be about 80% of the circumference of your arm.
It doesn't have to be exact.
Around 80%. It doesn't have to be exact.
Is your posture.
Other important tip is your posture. Should be seated up straight. That's not as important. The main thing is your elbow should be relaxed. So when you take your blood pressure, you want to have it relaxed on like a table or something. And you also want the elbow or the brachial artery at around the same level as your heart. So for me, it would be about this high. So next we want to talk about the steps that are involved in the blood pressure.
This video was created.
As you continue to read in your chapter, I wanted to point out pumping action of the heart. Sometimes we take blood pressure without the understanding of the pumping action of the heart. I won't read this paragraph to you, but it's very important. I would like for you to read this paragraph as well as peripheral vascular resistance. As with the other pulse, temperature, and respiratory rate, how we had factors that affect those, we also have factors that affect the blood pressure. Take your time and go through these factors. You have age, exercise, stress, race, sex, medication, obesity, diurnal variations, medical conditions, and temperature. If you have any questions, write your questions down and I will be happy to answer those for you. Look at the race cell. African Americans older than 35 years tend to have higher blood pressure than European Americans of the same age, although the exact reasons of these differences are still unclear. As we continue to look at hypertension in your book, I believe it's on page 500 or so, look at here. I wanted to make sure you understood this. A blood pressure that is persistently above normal is called hypertension. And know, as you continue to read our talk, know that the patients, when they come in and they have a high blood pressure, they have to be diagnosed twice at 2 different times. Not diagnosed. They have to have 2 high readings at 2 different times to say that they have high blood pressure. Now, down here where I highlighted, high blood pressure is when either the systolic is higher than 140 and when the diastolic is 90. Diastolic, sometimes you guys are really hard to get down. So when we see a patient with diastolic 90 and 110, we need to really do some education and see how we as nurses can educate to help get that blood pressure down. Now, this table is from the book, table 29-4, but I also presented earlier the table from the American Heart. And from the American Heart is what we'll go by because things are, like in nursing, constantly changing and research. So that's the most recent research of what I pointed earlier from the American Heart and American Stroke Association. Please read this area about hypotension, and in it, it tells you what hypotension is and also about orthostatic hypotension. I want you to read this area about orthostatic hypertension, as you will be asked in your nursing to do orthostatic vitals on a patient. So I don't want you to go, what in the world is orthostatic vitals? You would take the blood pressure along with the pulse and do these steps. Perform the steps. Remember, we talked about cortical sounds. So it's here, but I will refer you back to ATI so you can see the video for it. And also, I didn't mention earlier, but I want you guys to make sure that when you're taking the blood pressure, it's at the heart level. Legs uncrossed and not speaking. Patient not speaking. Most patients in the hospital, they now have the disposable blood pressure cuff. But if you are in a place and they don't, make sure for infection control, we're wiping the cuff with approved disinfectant. Wiping a cuff with approved disinfectant. Sometimes we forget about our older adults when taking the blood pressure. So I want you guys to focus on this area and make sure you look at the medications, how fragile the skin are. I talked a little bit about pulse oximetry, and these are the areas where we can take our O2 saturation, our pulse oximetry. Can wrap around even for our little ones, their hands and the foot. Now, when you take in a patient's O2 saturation, these are their normal readings. They should be 95 to 100%, but you might still find someone in the low 90%, like a patient who has COPD, coronary obstructive pulmonary disease. Less than 70 is threatening. Patient is not doing well at all. Look at this slide regarding pain. Make sure you ask your patient make sure you do your ongoing assessment and ask about these qualities. And if they're unable to do the number scale, then we'll try and do the Wong-Baker Faces rating scale. Here are some final thoughts that I would like for you to read. Have these thoughts on the slide and also continuing on to here. Now I'll go to this link for a recap of what we talked of, and I hope it puts a smile on your face. Thank you for listening.
Tuned in to the Bees Beats of Harley Records production. I got my boy Stacey on the mic tonight. Yo, Stacey, talk to me.
The first thing you do when you walk into a room, you gotta knock and say hello. I am a student nurse. I'm here to take your vitals. Wash my hands and here we go. For a tympanic tip, attack the pillow, pedal, pull the cranium down the right and back. Put the probe in your canal, rotate towards the jaw, seal it good and push the button like that. Take note of the reading number, you gotta get it right to be safe. And throw out that old probe cover, put the thermometer back in its place. Cause we take battles one at a time, you gotta do it right to save lives. BP 10%, respirations on the floor, you must emphasize. When you're not paying attention, count the respirations for 30 to 60 seconds time. Note rate rhythm and depth. Patient's arm across their chest while they're sitting or supine. Find the radial artery which is on the thumb line. Use these two fingers only, push slightly but firm. Never use your thumb. Do you confirm? What's the rhythm like? And the quality? Irregular rounding, strong quick and ready. Count for 6 seconds every time you hear a beat, then try both wrists simultaneously. Cause we take battles one at a time, you gotta do it right to save lives. BP 10%, respirations on the floor, you must emphasize. Patient sitting or laying with feet flat on the floor, legs uncrossed and at rest for 5 minutes or more. Hold the patient's arm at the level of their heart. Find the right side cuff bracket, firmly not to tug. Find the radial artery, palpate while you inflate the 30 millimeters of mercury until you can't let this way. Put scope on brachial artery, release the air slow. Read at eye level, numbers high and low. Cause we take battles one at a time, you gotta do it right to save lives. BP 10%, respirations on the floor, you must emphasize. Cause we take battles one at a time, you gotta do it right to save lives. BP 10%, respirations on the floor, you must emphasize.
Thank you for listening, and don't forget to write your questions.